Hey, I'm Jade Wally. I'm a Noongar woman from Balladong country down near Perth, Central Wheatbelt area. I'm a GP registrar here at Brahms. My role here is quite there's a bit going on at Brahms. I do a bit of chronic disease work with the chronic disease team here on Tuesdays. I do kids clinic on a Wednesday, and every other day on the floor seeing other patients from community.
So Jade, how do you know if someone has ARF?
So main things that we look out for, the different symptoms are things like if they've had fevers, any sore throat, any sore joints, and a lot of the time some people come in with all of the above. And we also check to see if they've been unwell recently, with respiratory infection, because that can normally be the start of something like rheumatic heart. And sometimes as well in the older patients they can have a bit of heart pain or shortness of breath, which kind of directs us to check out their heart and see what might be going on.
So how do you know if someone has RHD?
So with RHD there's actually, particularly being up in the Kimberley, they've got guidelines for us to help us know when to investigate for RHD. The main things that we look out for clinically, is examining them, listening to their heart, checking for any murmurs, and if you do hear murmurs, then investigating that further with an echo, as well as, if it's a bit, the clinical picture, you're unsure, we usually like to get blood tests as well, particularly in our adult population, which include, like a CRP and strep serology, and then usually with that picture, as well as an ECG in clinic, to just check for the PR interval. If you're looking at the guidelines, there's certain criteria with all these symptoms that kind of match whether or not RHD or ARF is likely, and you kind of put all those together to see, and then refer on to cardiology if there is a RHD picture.
Hi Jade, what's important for doctors and nurses to understand about Aboriginal people and how they can care best for people with RHD and ARF?
I think the main thing is, for all of us in healthcare, it's very important this day and age to equip yourself with a bit of cultural knowledge, particularly for our First Nation people. For me, regardless of having a Noongar background, coming up to the Kimberley, it's still, there can be differences between, different language groups. And for me and, Brahms especially, they set up for all doctors and workers to have cultural awareness safety training, and I think that's definitely very important before working in in an AMS or in a setting where you are dealing with Aboriginal patients, particularly those with rheumatic heart. With that there comes a lot of things. I think we can be distracted in not being aware that living circumstances can differ amongst Aboriginal communities, and it's really important to understand that Aboriginal patients with rheumatic heart, they still want to be treated if possible within their communities, and with all our rheumatic heart patients here at Brahms, we like to make sure that they feel culturally safe, and that it is quite an upsetting disease in that they do have to get regular monthly LAB injections, which means coming in every month, which personally would be a hassle for any of us. So I think it's just very important to be aware of each person's circumstance, and every patient's different, and people can be out community way or in town, and just have to be a bit flexible when it comes to recall and seeing everyone each month, and just making sure that they feel safe when they do come in, and a lot of that time that means that they see their health workers first, and particularly for our kids it means keeping them safe. No one wants an injection, or no one wants to give injections to the little ones, and it is quite traumatizing for not only the kids but parents as well, and so I think it's definitely important that when it comes to educating about rheumatic heart, that everyone's on the same page, because we've definitely had patients who, when you get diagnosed in the hospital, because it's so overwhelming sometimes, a lot of information gets a bit lost in translation, that, you know, from healthcare follow-up like an AMS, that we rediscuss and go over the importance of coming in each month. And again, that's just breaking down language barriers and making sure that everyone's on the same page and understand the importance of looking after the heart, and ensuring that they do get good follow-up. And yeah, I think the main thing is, as I said, just cultural awareness and knowing that, you know, a lot of the times trying to fix problems is quite difficult, and, you know, crowded housing and living conditions, it can be a difficult thing to try and make these, you know, environmental health changes, and to be flexible with that, and to not be pointing any fingers, because that's just, you know, way of life for most of our mob.